Everyone, welcome back to my channel. My name is Shirley, and I'm a second-year Bioengineering PhD student at California Institute of Technology. I previously graduated from UC Berkeley with an undergrad degree in bioengineering. And today I want to explore with you, should you choose bioengineering as a college major or your career? So to start off with, I chose bioengineering for myself because I wanted to help people with their health. As someone who volunteered at a local hospital, I saw a lot of lovely folks who had to die at a young age because there weren't a treatment or cure for their disease at a later stage. So I thought that maybe it's a good idea for me to do bioengineering and find a cure for them so they can live a longer and healthier life. But something I'm going to consider is that it takes at least 10 years for the initial drug discovery process to go into the commercialization process where the patient can actually take the drug and feel better. So to break it down for you, it takes the first stage is the early drug discovery stage, where scientists will sit down and do the research and development and design the drug. The second stage is called the preclinical phase, where toxicologists will look at PK models and see how the compounds in the drug will affect animals such as rats or rabbits. And in stage 3 is the clinical phase, where scientists will test on human subjects and see if the drug is safe for human consumption, and whether or not the drug actually works as expected. And last but not least is the regulatory approval by the FDA, and altogether this could take a minimum of 10 years. And how this ties back to whether or not you should choose bioengineering as a major is that as an industry itself, it takes a long time for you to see an impact on patients. And also that translates to your degree because it takes a very long time for you to do a 4-year undergraduate degree. And even after that, in order to be in a role such as a scientist where you get to play with the drugs and sort of design the drugs, it'll take you additional education on top of an undergraduate degree. It could take you 1 to 2 years to get a master's, and it could take you upwards of 5 to 7 years to get a PhD. So bioengineering as a field is definitely a marathon and not a race. So bioengineering as a field is a marathon and not a race. And something I want to shout out is that there's a huge culture in our society for financial independence and retiring early. And certainly, bioengineering as a career does not really align with this value. So therefore, if you're someone who's looking to retire early at a younger age and be able to not worry about working in a company, then you should probably consider software engineering, because nowadays it only takes a short bootcamp of 6 months or shorter in order for you to learn the basic competencies to become a software engineering and work in a tech industry. And you can also choose to work in a biotech industry as a software person. So if you still want to make an impact, software engineering could be the way to go if your value lies in retiring early. And according to the Bureau of Statistics and Labor, the average salary of a software engineer is around $110K, whereas the salary of a bioengineer is around $86K. So the salary is not too bad. However, it just takes way longer for a biomedical engineer to get their degree and become a scientist as opposed to a software engineer. So to tie it all back, to whether or not you should choose bioengineering as your career, you really need to ask yourself what your values are. If your value is to make a direct impact on patients, then yes, you will need to go on that marathon and dedicate your life to kind of research and development and researching how drugs can make people better and how can it solve cancer and things like that. However, if your values are to have a work-life balance, or is to sort of be able to have financial independence and retire early, I would highly recommend you to look at the intersection of computer science and bioengineering, where it doesn't require as long of a time and the pay is certainly a little bit better. So lastly but not least, I just wanted to point out the different fields in bioengineering because bioengineering is such a broad field. So for bioengineering, there is medical devices, and there is medical imaging, there is cell and tissue engineering, and there is synthetic and computational biology. And in my next video, I'll talk more about what these concentrations are, and as well as any other questions you might have about this field in bioengineering. Thank you very much. Please comment down below what you'd like to see in my future videos, and make sure to like and subscribe my channel.